For about the last 6 years, I've been very heavily involved in treating patients who have unfortunately been through a concussion. We see a ton of that in youth sports, and as I sit on the board of our local football team and I have 2 kids that play football and also a daughter who's been involved in basketball, which we do see a lot of concussions in as well, it's been near and dear to my heart to make sure that patients who suffer from symptoms of concussion are well taken care of. What's interesting is it's not just sports that we see the concussion in, but we see it just because people are playing around or monkeying around or getting hurt. We also see it as a result, especially in adults, after a motor vehicle accident that they've been concussed. And it's really pretty obvious most of the time if there are symptoms right away, right? Like you get a headache, you feel like you're in a fog, maybe your memory isn't as good as it should be, you're a little light sensitive or noise sensitive, and you can tell that something is off right after a concussion. But what most people aren't realizing is that there's a lot of symptoms that will continue long term as a result of that concussion that then you don't necessarily pay attention to. And I want to make you aware of those because they actually can be quite detrimental. So what we're seeing in a lot of our patient population who have gone through a concussion is years later, besides even still having headaches or memory problems, they now are having a lot of gut dysfunction. And we see something called leaky gut, or infections that will affect the GI symptom that may just now result in abnormal bowels or tummy pain that could have been a result of the concussion. We're still seeing learning issues and ability maybe not to operate at the speed you're used to or recall certain things quite like you used to. And even though the concussion has long since been over, you associate that with other things, maybe getting older or maybe hormone changes. And yet those hormone changes or the age effects might be exacerbated because the concussion wasn't properly taken care of. So I would challenge you to take a look and figure out that if you've ever received a concussion or even suspicious that you've been through a concussion, we take a look at some of those symptoms to see if it can relate back. Because not only time will heal that, but if we can get involved in nutrition and looking at anti-inflammatory type products to help speed along that process, we can make a very profound difference in those side effects going away much quicker. So whether you've been concussed recently or you've suffered years ago and you still think that there are side effects as a result of that, I would love to explore that with you and see if we can narrow that down to that concussive episode and then create a plan through proper foods that'll reduce the inflammatory load and certain supplements that we know in research have played a profound effect in cognitive function, in memory, in locomotion, and just overall healing of the brain. We can certainly get you on a path to get rid of most of those symptoms. Concussion is a very real thing and it's more common than we think, also not something to mess around with and just ignore. Let us know how we can help.